Fat grafting to the breast versus breast implants. Let's talk about it. So this is a hot topic in plastic surgery, especially as patients are moving away from breast implants and looking at alternatives like fat transfer to the breast. But there are certain compromises that you have when you use fat grafting instead of breast implant. The difference between breast implants and fat grafting is related both to breast volume and the shape of the breast that you're hoping to obtain. So with fat grafting, you're relatively limited on how much additional volume you can achieve in the breast, whereas a breast implant, typically you can get 1, 2, multiple cup size increase depending on your breast tissue. The other element that's different and critically different really is the breast shape that you'll be able to obtain. And so I really need these images here to help me convey that information. So these are different breast shapes, and they largely differ in just how much roundness and volume is up at the top of the breast when you're out of a bra or clothing. So breast implants are very good at getting the shape to change. So let's say we're starting with a natural breast shape over here. You can use an implant to achieve this shape far over here, okay? And that's because the implant itself will maintain its shape underneath your skin, keeping that volume at the top against gravity. Fat grafting, however, I find once everything has settled, usually 3 to 6 months out from your fat grafting procedure, the shape where you're starting is typically the shape you'll still have even after the surgery, once everything has settled. So if you take a patient who has a breast like this shape and she were to have fat grafting to that breast mound, well, she'll end up having the same sort of shape. It'll just be a little bit bigger, about a half cup size. And so for some patients, that's sufficient. They like their breast shape. They just want it a little bit bigger. Fat grafting is an option. If it's a patient that wants a significant volume change or wants to dramatically change the shape of the breast, that typically is more of an implant patient. So which shape would you like to be, and how might you achieve it? Hopefully now you have a little bit of guidance on that, and it'll help you in your research. If you're interested in trying to figure out which shape you'd like to achieve and how best to achieve it, feel free to reach out to us on social media or through our website at alamoplasticsurgery.com, and you can get a consultation with me.